everyone, and happy Thanksgiving. Again, as you're all aware, my name is Tiffany Griner, and I will be giving my speech this evening on the flu virus. As the cold weather approaches and the seasons begin to change, we all know what this brings: campfires, football, hot chocolate, pumpkin pie, and of course, the best, Santa Claus. But what else does the season change bring? Flu season. The flu is an upper respiratory illness caused by either the influenza A or influenza B virus. It can cause mild to severe symptoms and in some individuals even death. So it is important to make sure you are educated on all the facts regarding the flu this season to help protect yourself and those you love from getting this illness. Remember, it's always important to spread holiday cheer, not illness, this season. As stated above and directly from the CDC website, the flu is a very contagious upper respiratory illness caused by either the influenza A or the influenza B virus. The older population, very young infants, pregnant women, and people with certain health conditions such as asthma, heart disease, diabetes, and weakened autoimmune disorders from diseases such as HIV or AIDS are at greatest risk from complications if they were to obtain the flu virus. The very best way to prevent yourself from getting the flu this season is to get the most up-to-date flu virus. However, good hand hygiene, healthy eating habits, getting enough sleep are also good ways to help promote good health this season. The flu vaccine can help protect you from getting the virus, or it can make the virus much milder if you were to still contract the virus after you got the vaccine. However, if you are allergic to the flu shot or have an egg allergy, you cannot receive the traditional flu shot, so you must speak with your healthcare provider regarding your treatment options to prevent yourself from getting the flu. Children less than 6 months old are also not candidates for the flu shot, so it is important if you are going to be around an infant less than 6 months old that you protect yourself by getting the flu shot so they in return are protected against the flu this season. If you have had Guillain-Barré or GBS, which is a severe paralyzing illness, you can also not receive the flu shot. If you are experiencing a fever at the time you are going to be getting the flu vaccine, it is important to wait till your fever subsides before your vaccine is administered. There are two types of vaccine, the flu shot and the nasal spray. It is important to talk to your doctor about which option is best for you. It is also important to know that if you do get sick this season, if you're actually experiencing the flu or some other respiratory illness such as the common cold. Also, according to the CDC website, symptoms for the flu include fever, cough, chest and nasal congestion, sore throat, headache, body aches, muscle pain, fatigue, and GI complications. The duration of your illness can vary. It can last a few days or up to 2 weeks and beyond if complications arise. Common complications from the flu include pneumonia, bronchitis, and certain ear conditions. Protections from the flu include covering your nose and mouth when sneezing, washing your hands frequently, especially when out in public, disinfecting your personal space. So when you're at work, disinfect your desk. When you're at the gym, clean your equipment before and after use. When you're at school, use hand sanitizer in between classes. And when you're at the grocery store, I know Giant Eagle does a very good job at using Purell cleansing cloths before you use your grocery cart. Eat a very well-balanced diet this flu season and sleep 6 to 8 hours a day or night depending on your work. Avoid close contact with people who are sick, and remember, if you are feeling sick, stay home. However, if you do get the flu, there are treatment options. There's an antiviral drug called Tamiflu, which is taken for 5 days, and it works best when it is started within 2 days of getting the flu virus. It comes in liquid or powder form. However, there's no treatment option for people with COPD or severe asthma, so it's best to just prevent yourself from getting the flu if you suffer from those complications. Stay home, rest, and take fever-reducing medications, which can also help with your pain symptoms associated with the flu virus. It's important to stay hydrated when you're sick, so be able to drink and eat as much as you can, even when you don't feel like it. If you're unable to eat or drink, you're having difficulty breathing, you develop a rash all over your body, or you become too ill, it is best to call your healthcare provider because complications could be arising and you may need to go to the nearest emergency room or healthcare clinic for further evaluation. If you care for somebody with the flu this season, it's important to avoid close contact. Monitor their temperature and give medications as prescribed to treat their infection. Make sure they are staying well hydrated and monitor the severity of their symptoms so that you can intervene if necessary by taking them to the appropriate healthcare clinic if their symptoms worsen. It's important to disinfect all their personal space frequently. After the flu has passed either your house or someone you love's house, it is important to change your toothbrush. Wash your sheets and disinfect the areas you were in while you were sick. In conclusion, as you all know and now know, the flu is a very serious virus, but it is one that can be avoided. Make sure you and your family members stay healthy this holiday season and know the severity of your symptoms. This holiday season leaves no time for illness, so it is best to wash your hands, cover your mouth, and keep up your holiday cheer. Thanks, and have a good night.